We are live now, doctor.
So, a very good evening to one and all, and I welcome you all to another episode of EUREYEKA Innovations in Ophthalmology. And we are back with yet another very inspiring episode with another very inspiring topic. So, today we have a very, dynamic speaker who will be talking to us, and a very eminent panel who will be sharing their insights on it. And without any further delays, I'll begin with the introduction. So, as all of us will be knowing, the person who needs no introduction is Dr. Prasanna Venkatesh Ramesh, who is also our Joint Secretary of the Young Ophthalmologist Society of India. He's currently the Research Director and Glaucoma Head at Mahatma Eye Hospital, Trichy, India, and has published several papers, chapters in PubMed Index journals. He's also the Editor-in-Chief of the recently launched book, Oculus Res Geste, the editorial board member of General Ophthalmology and Video Section, IGO. He's also the committee member of TNOA, chief instructor in several instruction courses in international and national conferences, and has won several awards in various international and national conferences. A very warm welcome to you, Dr. Prasanna.
Thank you, Sam. For
Next, we have Dr. Kim Ramasamy. He's the current Chief Medical Officer of Arvind Eye Hospital and Postgraduate Institute of Ophthalmology, Madurai. He's also the Director of IT Services of the Arvind Eye Care System. He has undergone fellowship training in vitreoretinal specialty both in India and later in USA. He's one of the early pioneers to introduce teleophthalmology in India and also develop the teleophthalmology network of the Arvind Eye Care System, which caters to more than 3,000 patients every day. Under his leadership, the hospital IT team has developed an EMR, electronic medical record, which is currently used in all Arvind Eye hospitals and several other eye hospitals and serves the backbone of everyday functioning. He has authored several chapters and has more than 200 publications. His current interest is in using AI for DR screening and has worked with Google for the same. He was honored by Mr. Sundar Pichai of Google for nominating his work as one of the best to happen in the next 25 years in the Wired magazine. And he's also the current president of VRSI and past president of Teleophthalmology Screening Society of India. He was recently listed in the Stanford's top 2% of researchers in the world, and I have seen Sir's work personally, and it's absolutely a true wonder. A very warm welcome to you, sir, and thank you so much for taking out your valuable time for today's session. Up next is Dr. John, who has been a panelist and a speaker of this series several times before and is a very well-known innovator. He is currently working as a glaucoma, cataract, and refractive surgeon in West End Eye Hospital, Chaitanya Eye Institute in Kochi, Kerala, and has worked before in Little Flower Hospital, MNI Hospital, and Ramachandra Medical College. He finished his education from JIPMER and followed by Shankar Nethralaya and has presented in several national, international, and state conferences with several awards to his names. More than that, his innovations are something which stand out, and he also holds a patent for his innovation foldable fundoscope and has won several startup challenges and incubation. A very warm welcome to you, sir. Thank you for joining us today. Over to you, Dr. Prasanna, sir.
Yeah, thank you. I'm sharing my screen. Can you, yeah. Is my screen visible, Sam?
Yes, sir. Yes, sir. Just full screen.
Yeah, I'm going for it.
Just a small second, sir.
Yeah.
So we also have our president of the YOC president with us, Dr. Devakant Mishra, sir. Sir, over to you for a small inaugural address.
Thank you so much, Sameer, and I would like to take this opportunity to welcome Kim, sir. It's a great honor for us to have him and a very relevant topic to discuss with him. And this series that Sameer has started is very pertinent to young ophthalmologists. I think innovations is the way forward for ophthalmology and for the betterment of the society as well. So over to Prasanna. Very excited to hear his winning pitch.
Thank you, Devakant, sir.
Thank you.
Yeah, at the outlet, I would like to thank Team UC for the opportunity and Kim, sir. Thank you, Kim, sir, for being here. and he's somebody I really look up to. And thank you, sir. It's such an honor to be part of this wonderful series. And I took your advice seriously, and I also changed my look also, sir. Thank you. Thank you for the guidance always. And thank you, Samir. Thank you, John, sir. So where it started, for the next 5-10 minutes, I'm just trying to keep it very candid, so that it will help people who are aspiring for these kind of Shark Tank competitions. So for me, it started 12 years back, and these are some of my photographs. And I love making a lot of movies when I was back in the day in colleges. And these are some of my After Effects that I made myself. As you can see, in 2010, we made this. A movie which was named Timeless, and you can see the After Effects that are part of this. So at that time, 10-15 years back, we didn't have much of the graphic arts that we talk about today. And it was always there within me to do these kind of things back in the day. Each one of us will be having an hobby, and these are all some of my batchmates, undergraduates. Each one of them are placed well in their life today. She is a psychiatrist, and my movie was about a fantasy involving, a romantic novel. So that's something that was always part where I was fascinated in movie making. Then slowly, when I took up ophthalmology as a career, I wanted to see how I can incorporate this into ophthalmology. And that's when I started the company MCMI, called Mahatma Center of Moving Images Private Limited. So I was ably supported by my sibling, Dr. Shruti, at the starting of my career in this particular journey. And she's still supporting me from abroad. And slowly but steadily, the team started building. As a startup, I always felt it has to be a team effort. And we started mainly into imaging, animation making, which we started publishing it as well. And then came the team, which I always feel you need to move forward together as a team, followed by the people that I'm showing, along with the patenting that we started. And that's what took us here. And the startup was also launched in the year 2021. And we started incorporating our mobile applications into it. The first innovation was an Android app called the IMG AR, and then we wanted to crack it in 3D as well. Augmented reality is AR, and then 3D was a 3D Atlas. So they were all more like a two-dimensional or a three-dimensional platform. And I used to present these in conferences whenever I go and share this in my scientific deliberations. Then we went into three-dimensional creation of models like a circle of Willis, a cavernous sinus, and then pushed into HoloLens. And I was able to show it to some of my teachers when I cracked this in the year 2021, 2022, to some of my professors, where I was able to show that demonstration. And we were able to, get their feedback on how teachers wanted it to be the way it wanted it to be. So the two-dimensional and three-dimensional facets were actually evolving, and startup was always on my mind to actually start this as Mahatma Center of Moving Images is what I labeled it, and we registered it under MSME. I didn't know it will help me in this competition. If you are a young ophthalmologist attending this particular webinar, startup is something which is very important for your Shark Tank competitions. So then I actually visited a company secretariat and made it officially as a subsidiary of part of my organization that I am part of, which is Mahatma Hospital Private Limited, Trichy. And you need to have a registered company. It can be anything. So MCMA was actually registered under the child company of Mahatma Hospital, and then patent was also not filed under my name, it was under the company's name. So these are some of the things that I would actually advise you. When I started my journey in the early days, should not file the patent in your name. It is always better you have a startup and then file it under the startup. And also register it under the Ministry of Micro, Small and Medium Enterprises will always give you an edge. And the category was private limited. So then moving forward, the applications were always evolving from Android to smartphone, where iOS, which was an Apple. So that's how the mobile applications were evolving, which is an Atlas, augmented reality. And as a beginner, you always, just restrict yourself into you launch it and you present it in conferences, which I was also doing. And it was just matter of winning awards and at that point in time. Then came in the trademark. So once you do your MSME, you have to do your trademark, and this is the trademark of uh, MCMI, which you can see we took it very seriously. You need to have a website as well. So this is the website of MCMI that you can see here on your screen. You can go to www.mcmi.in and this you'll get it. And we started making a lot of videos. So you can see the website, we had a launch and we started making videos not only for us, but for others as well. So this is I as a camera where, we started making videos for other doctors who had different ideas. So to name a few, we made one for Dr. Lakshmaya sir. We did one for Dr. Shrees sir. He wanted one on posterior polar cataract, which was one of the novel innovations which won the best paper in last year in TNOE under cataract category. I made one for my beloved uh, mentor and godfather like Dr. Nadarajan Sundaram sir. He innovated an iris claw, not an iris claw, a claw-like instrument to go and take the foreign body from the posterior segment. We start these all small things. What a beginner will actually tend to do is making a lot of videos. Ophthalmology is an image-based field where you make a lot of videos. This was one for Dr. N. Satyan sir on vertical versus horizontal chop. How you do a chop. These are some videos which are not available on the internet, and these are some of the other OPListic videos that we have made. So our company had this thing to push forward. So when we do, for example, when we have doctors along with engineers working together. So in my which has to be engineered where we can create our own metaverse training module. So we go to the drawing board and we created an instant metaverse where we can go and practice not once but multiple times to place the implant. And then we started presenting it as well. This is how it started. You start and your company grows. So basically it is doctors and optoms. It was a self-funded company. It is still a self-funded company where we started utilizing our resources and keeping on moving forward with whatever we can, and publications and 3D printing applications, YouTube. YouTube is another medium which we strongly use, and we started. So ACRS winning pitch was always on my radar. In 2022, I submitted this for the first time. It got rejected. Second time, again, it was a rejection. Third time, again, it was a rejection. So it was a very tough company, tough competition. After three rejections, I didn't give up. In 2025, I submitted it again. But throughout the course of this journey, every time I learned something new as to how to pitch yourself. Because having an idea alone will not matter. You have to submit it with a vision, and then you have to refine it with a mentor. Every time they will give you a mentor and you'll have to refine it accordingly. This is the website link if youngsters are having a look at it. So this is the https winningpitchchallenge.net. It happens with the ACRS. It happens with the American Academy of Ophthalmology, and they inspire innovations. Depending on your pitch, they give you grants and they also connect you with industry partners. Winning a cash prize is not the end. You also get to connect with industry partners like the who's who of global ophthalmology. So in step one, you just need to go and read the instructions. You have round one, round two, and round three. So in my previous three instances, I always went into round two and I got rejected. So basically round three is the round where you need to go there and present. So these are the guidelines that they share with you of how you have to go through these three rounds of selection. Something that we do in our innovation competition as well. So in round one, you need to analyze a real world clinical problem and you need to fill a Google form. I have simplified the Google form as here. Along with your name, degree credentials, other things, they would want to know whether you have applied in the past and they want to seek your commitment. If you are selected as a finalist, will you be able to come there? Because they don't provide accommodation or travel grant. So those are the things that they would really want to get commitment from you. And also, they'll ask you if you are going for a 45-second honorable mention, will you be able to give a recorded video? And prior funding and revenue, they will always ask, what is your startup? Is it an early startup? What is the total equity financing of your startup? So you should know about your startup equity. Is it less than 10 million or is it having less than 1 million in the past 12 months? So they are open for startups only. So need to have a startup. Me thinking hindsight in 2021 when I started my startup 4 years back, really crack this competition. So the answers, yes, you have to answer or know whether you have been part of it. And then you have to give your revenue model. You have to share your funding. What is that? Who's funding your project or how did it come this far? And what is your revenue model? And all those things you'll have to share. And other things like what is your company's name? That will be one that they'll be asking you. And please describe what ophthalmic unmet need you are trying to solve. So that is something you need to pitch. So you can see in my pitch, I pitched that I'm trying to work on a 3-dimensional or a 4-dimensional EMR, pedagogy, accounting tool. What is your solution? That is something they'll ask you. What is innovative about your solution, technology, and business model? So in the initial days in 2022 and 2023, when I got rejected, I thought all of them were same, but a business model is different, a solution is different. What is your marketing strategy? So all these are things that they will ask you. How will you fill in the gap? Which is not something that you encounter in a on competition, right? Because they just see your innovation and they'll be okay with it. But then in these competitions, you need to have a clear idea. And they'll ask you what is the market size in number of people and in terms of dollars also. Both they would want to know. And what is your idea in targeting? What is the number of people that you are going to target? And what is the, in terms of dollars, you see here me answering them at least 5,000 users with around 2.5 million USD per year. So you need to give them a clear idea of what is that you are looking at. And what is your advantage relative to your existing potential competitors? So why will you win? So these are some of the things that they ask you. And what are the key economic drivers, like business economics from a price point of view, margin, cost by revenue streams. So they'll want to know everything once you pitch in your business model, along with capital investment and outside investment. So you need to really get your thing sorted before you really go, before who's going to be your capital investor or if you're going to get an outside investor. So everything has to be really, really very clear. Timelines. How much capital are you seeking to raise? What is the milestone to raise the funds? How much long will it take to achieve it? And you have to answer for each and every question. So this is the yellow highlighted ones are the ones that you're seeing me answering. Like we are seeking around 50,000 USD to further develop the models and scaling and commercializing. You are looking at me answering them that I need another 1 to 1.5 years more to actually commercialize the product with the total capital requirement of 100,000 USD for further R&D. So everything has to be clearly pitched along with your FDA approval and regulatory pathway. So the initial days in 2021, 22 didn't even know what is regulatory pathway. So these are some of the things that you need to keep guidance on, and what is the class under which your innovation comes. So mine came under class 2 medical device, which was for software-based medical technologies. You need to know these aspects as well before you pitch into this. And you need to give them their timeline very clearly. And what are the phases, phase 1, phase 2, and what are you looking at? and intellectual property. So they'll ask you whether you have filed an IP and what is the IP filed, who owns the intellectual property. And another very important disclaimer is they'll say that this is a public event and you're going public. So your innovation will be out. So it is better if you have an IP so that it is protected. And describe your team. So you can see on the left hand side here, your team will be required a complete description of what each one has contributed to. Who's the lead, who's the hierarchical positions of your team, and what has each one contributed. So they evaluate each and every part of it, and it doesn't have an entry fee. So that is one thing about this particular competition. Anybody can participate, and it doesn't have an entry fee, but withdrawal penalty. So if you are going to the finals and then if you are not going to, be there, then that part is something that you need to keep in mind, because you need to travel and you need to go there. They'll not support that. And there is non-confidentiality statement that you need to go through. Use of conference materials and changes to competition rules. It happens once every year or once every 2 to 3 years, which you need to keep a note on. And decisions regarding the win and competition. So you need to keep all this in mind. The entry fee is definitely not there. The withdrawal penalty and disqualification rules, because this is Shark Tank at the highest level. And once you cross round one, you enter round two. And in round two, you are now matched up with an industry mentor. So they now know that you got your whole thing sorted. Okay, these guys know they are a startup. They have all this part of things starts. That's when you ascend to round two, where you will get an industry mentor and he will mentor you one on one. So these are some of my mails where you can see that your mentor will message you and you both will get on a Zoom call. I was lucky to have the vice president of Bosch and Lobb, one Mr. Chuck Hess. So he's one of the board members of the Accelerator competition, and he mentored me for close to 2 months. And once the mentorship, so I was able to get on 3 to 4 meetings with him as how I need to prepare my pitch, my 5 minute video. So first time I was giving him a video, something like how I present in an ophthalmic competition, in a conference, in an ophthalmology conference. He told me, no, 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 this is not how you pitch yourself. Completely revamp your whole slides. And he guided me from A to Z, and working closely with the mentor, and then submitted my 5 minute presentation. So this is my 5 minute presentation, where I started with my trademark logo, which you can see. And then I'm going to present that this is going to be a holographic EMR that I'm going to show. And then I'm taking them into the imaging that we do, be it ASOCT, a sheen plug imaging. And this was a pitch video that my mentor helped me get it. I'm just playing this without fast forwarding it. So you share all the data that you are going to pitch. So I'm going to say that if the whole patient, once he enters into the hospital, whatever imaging that we do, fundus or lens imaging, which you do with the Anterion or a sheen plug imaging device, angle photographs, corneal photographs, a UBM. So all are matched as a template, and the patient gets a complete 3D 4-dimensional case sheet, and it is going to enhance the diagnostics and also engage patient engagement using this live unique 4D evaluation. So current existing tools are in the 2-dimensional plane, and where we are trying to, pitch in software which is on the third dimension or the fourth dimension, where even in the funduses, you are able to slice and take out the OCT. That was something that we also pitched and worked towards it, where you can see from the fundus, you take the OCT slice and then you get multiple slices of examination. So basically, there was no blind spot. So that is the solution. It's a translational software is something that we are highlighting, suggesting that it is not an imaging tool. And then every imaging device from anti-segment to posterior segment, you get it. That is the solution that we as a company, we are pitching from MCMI. And once that is pitched, now what are the other criterias, the business models. So that's how it goes into I think I just lost my slides. Sam, am I audible?
Yeah, sir. So there's actually the video is there's a lot of lag actually.
Okay, 1 second. I'm just
Can you optimize for video, Prasanna?
1 second, sir. Now is it better? Hello?
Hello. So
Am I audible?
can you just play the video once, sir?
Yeah. Is it lagging or is it okay?
I think the problem is with the network, sir.
Now is it, I mean, there is no video as such. Is it moving now? Better?
Even this thing is getting there's some lag, sir, in that.
Okay.
Even your tile is like this thing is not coming properly.
Samir, I've just changed my network.
Yeah.
Is it
Yeah.
better now?
Now it seems to be slightly better, sir.
Seems to be better. Okay. Just let me know. Just pause me if the network is not good. Okay.
Sure, sir. Sure.
Yeah. So once we have pitched the idea, we say that whether it is recommended by doctors, a survey was carried out, you share the workflow, how the workflow is, you capture the image, it goes into the hospital database, and then the software converts it into a electronic medical record where you get the 4-dimensional approach. And then the device compatibility. So what are the device it is compatible? And if you can see this image here where we are pitching what is the market size from a US point of view, what is the market size from a global point of view, and what is our target. You need to have how many ophthalmologists, how many optometrists, and our target of how many institutes, whether it's a diagnostic manufacturers that you are targeting or only is it hospitals, and what are the companies, whether it's a patient education company or an EMR record supplier. So all these parts are detailedly plotted out. And then B2B. B2B is the business model that we have showed. It's a subscription model and it is going to be on a multiple platform. So each one you are, highlighting it very clearly. And then you also pitch out extra features like a simulator that comes along with these kind of modules. Once you create these holograms for each individual cases that enter, you create a simulative based learning, and also you finally you summarize it with a table showing how you are efficient from your competitors. So in our platform, it has multiple platforms, real diagnostics, physical rigged models, physiologically rigged models with voiceover, whereas the current ones in the market, what is that they have and what is that they don't have. And also your business model here. So suppose in 2025, if there is 25% conversion rate, that is out of 1,000 people you are targeting, 250 people are entering. So the worst case scenario will be an annual subscription model. That is the most cheapest one. So then what will be the revenue? So likewise, each year you'll have to give them a revenue model. And so we gave it from 2025 to 2029. What is your revenue model if it's a monthly subscription, a quarterly subscription, or a half yearly? And worst case scenario, what will be? And then you will pitch that this is what I am seeking. So this will be my pre-production cost, my product development cost, and my marketing cost, and general and administrative cost. So these are the 4 platforms it will come under, and where you'll have everything jotted in and you'll be pitching. So I pitched around 2.5 million, and then you'll be having a pitch video where you will acknowledge your team that these are all the team. Each one, this is the role that each one is actually taking care of. So this is the pitch that you do along with the guidance of your mentor in round 2. So once you make this video, at every point in time, your mentor will actually see and trim the video. He'll guide you. He'll say, do this, do that, change this, change that. And finally, it will go to the round 3. So round 3 is where you present it live, and you'll get a mail 1 month before. It will be a short notice. You'll be have to be prepared for it. And I was able to get placed in ASCRS. I did have some scientific commitments there. So I was able to go there and present this along with it. So I'm just sharing the business model alone. I'm just going for want of time. I'm just skipping few slides here. And the business model is the one that will really get you into the fulcrum. So this is the chart that you need to really work on when you go to the podium and pitch your revenue projection. So I pitch them that if this is going to be the next 5 years, I'll be able to 75% conversion rate. When I start, my conversion will be 25%, but as I move forward, it will be 45, 60, and 70 to 75. And if I'm going to have at least 10,000 users, then the worst case scenario, we'll be looking at 56.25 million. And it has to be realistic also. Like this is another chart, very important cumulative revenue and profit chart. So first 2 years, what I pitched them is in 2025 and 2026, if you're going to give us 2.5 million, for the first 1 year, I'll invest 1.5, and then another one I'll be investing in the second year. That makes it 2.5. And why I put it 2.8 is I'll be having a 0.3 profit, where that will also go back into investing. So that way, the cumulative revenue, the brown box, vertical brown line that you can see, will reach profit only at the 2027 and 2028, because I'm again putting the money back in and then it has to come. So this is how you calculate the cumulative profit and the cumulative revenue. These are all some things I learned during the course of the last 4 years. And why we are seeking what we are seeking is the one that I wanted to summarize with. You have to have a pre-production, a product development, a marketing, and a general and administrative module. So these four aspects are very, very important. And finally, there it is. So your 5-minute presentation can be changed once after the stage 2. And in stage 3, you will be top 3 people will be selected, and that they will announce the winner. So the board of directors, which I showed in the previous slide, so they'll all grill you. The presentation is 5 minutes, but they'll grill you for 7 minutes. So that's why it's Shark Tank, right? So each one will have 12 minutes, and then the voting will be done by the audience. So they'll call all the 3 winners, 3 finalists on the podium. And just like a Shark Tank, live voting will be taking place. The audience will all be given a trackpad to, vote for which 3 that they feel deserves to be on the top. And you get a prize money and a check for all the 3 who made it to the top. Along with it, you get to connect with the industry mentors, meaning you will be able to foster more meaningful relationship. So definitely, I did win 5,000 USD, but more than that, you will be able to connect with more people. So I think this is me trying to take the dummy check back to India from all the way from LA. I brought it to Trichy as a memory. And this is my mentor, Mr. Chuck, who helped me mentor and help me clinch this competition. He's the Bosch and Lob's global head. And to summarize to all the viewers here, so it's just not about an idea. So a Shark Tank or a winning pitch is you have to have a real world clinical challenge, and you have to have every points that I showed you, a business model. You have to answer all the questions. You have to have an MSME. You have to have a trademark. You have to have a company. You have to have a, a clear FDA approval, a regulatory pathway, a patent, IPR, and whatnot. And you have to have an industry expert's perspective into it about a proper cumulative profit. What is the capital investment that you are doing? And you have to have a complete mathematical calculation, and you get to present it live at ASCRS or AAO. They have this once every 6 months. And I was lucky to be awarded 5,000 USD for it. Not only that, but I'm still in connect with many of the industry partners. And this was one of my laptops that I bought, MSI Vector A18HX A9W model. It was around 3.5 lakhs. I invested the money back into what I do best, and into R&D. So thank you, Yossi and Samir, for this opportunity. I would like to take some questions if needed, and maybe I can throw more light on the same. Thank you.
Thank you so much, sir. Once again, it's as always, it's very, very inspiring, and it's very obvious. We always expect, whether it's any competition, whether it's AIOS, APO, TNOA, or ALC, we know that if Dr. Prasanna comes some award or the other, he's going to win, and still we end up getting, inspired and surprised by the stuff that you do. So we'll ask Dr. Kim, sir, to share his insights and thoughts. Over to you, sir.
Thank you, Samir, and for inviting me for this very, very interesting webinar. I think you've done a wonderful job for the younger generation. I think it's really, really inspiring because many of this is not accessible to a lot of people, though there is media, but these are very focused, ideas that you're bringing into these students. And Prasanna, I have no words for him. You've heard, I don't know, many of you may not know, there was a TV called Onida. And in that, the ad for that is owner's pride, neighbor's envy. This guy is an amazing, amazing guy. I wish every youngster has the fire burning in his stomach like Prasanna does.
Thank you, sir.
I think the it's not just running around, but the way he has calculatively moved every step going forward, planning so much of depth in the whole process. It's not just, getting an award or getting this thing, but just the passion and the purpose with which he has worked. Your talk, the entire thing shows how much of depth you have been involved in. I think this is something that every youngster should learn. We really, envy today's youngsters, the way innovation, the way you guys think, the way you think of new ideas. It's just amazing. I think, Prasanna, you are really an inspiring leader, and I think many people can learn a lot from you, and you should continue to.
Definitely, sir. We all got inspired by your work, and here we are, sir, a group of innovators.
But the scale at which you guys are doing is just amazing. And I think it's not just for the award, it's not for anything, but the way it is done for a purpose, a meaningful purpose in what you do. I think that's what makes all the difference. I think I really everyone looks at you and with all the envy that, I would say, but truly, we all admire the work you do, Prasanna, both in education. You started with the metaverse in a big way, and then you started moving around with teaching tools. I think these are wonderful. It's not just to bring awards to you, but what this can do to the younger generation, how it can educate them is something remarkable. Congratulations.
Thank you, sir.
On this talk and the wonderful work that you do. You continue to do this and keep inspiring people. All the best to you, Prasanna.
Thank you, sir. Means a lot coming from you, sir. I still remember when I was in my preliminary stage, I came to you in the year 2022 and I spent close to half a day with you, sir, in Madurai, Arvind. And each and every small tip that you gave me, sir, exactly 3 years back, it also helped me a lot in shaping me and molding me and believing in me, sir. Actually, very few people at the early nascent stages, many people told they are not able to understand, sir. Only very few people were able to understand. Yeah, anyway, but Nilesh is there on the other side now. I was talking more about, my producers who are apparently producing the projects of mine now. So, and Kim sir is very close to my heart, and I listen to you, sir. This is an example of it. So, the last picture which we took at the airport, and then that's it. I changed. So, thank you, sir. Really means a lot coming from you. Thank you, sir, from my bottom of it.
Thank you, Prasanna, and thank you, Samir, for doing this. It's a wonderful
Thank you so much.
platform for the students.
Yeah.
Thank you so much for joining us, sir. I know you are really busy, and it's very difficult for you to take out time. Just before you leave, sir, we'll just take a screenshot, sir. Like we just take a shot of with the Yossi symbol, sir. If Manjula, ma'am.
I'll take some.
John, good to see you, John.
Taken. and we can take it from YouTube also.
Thank you so much, sir. Thank you so much for joining us, sir.
Sorry, I have to run for a
Yes,
VRSI
thank you.
meeting.
Thank you, Kim sir, for being here. And this motivates us, sir. A group of innovators, John sir, Nilesh, myself, Sam. We are all following your footsteps, sir, and we will always seek your guidance. Always, sir. Thank you, sir.
Thank you, Prasanna.
Thank you, sir. Thank you, sir.
So with this, I would like to invite our next panelist, Dr. John Davis Akara, who is himself, a very, very renowned innovator and has been working in AI has been worked on with AI at very extensively. So, sir, your insights and your thoughts.
So first of all, superstar Prasanna, again, amazing, amazing, amazing. So always Prasanna never fails to impress. So I'm very proud that Prasanna has gone and did what he said he will do. And I understand it's one thing to develop an idea. It's another thing to go into the business aspects of it. So Prasanna has gone both the innovator side as well as the business side completely from the bottom up. He has gone through, and he has also explained how he did it and how anybody else can do it. So I'm very, very impressed that he has gone in detail so that anybody who is inspired by Prasanna, that is so many young ophthalmologists, will now know, okay, this is what you need to do to get to the, get to the same topic. So, starting a business, doing the work, starting from registering an MSME to registering a private company, doing the trademarking, the intellectual property, and the way he went through each and every aspect of the rules of the game, that is very impressive. He has gone through the nitty-gritties of the challenge itself and how he underwent the whole challenge, how he went through every hurdle and did not give up. So that is very, very impressive. It is very difficult to stick through till the end of anything. And so this is brilliant. And Prasanna has always, he has followed his passion. So he has started from his idea of create teaching. So he wanted to create all these animations and videos to teach. Then he thought, okay, how can I do this in a different way? How can I do it in a way which understand? And then he did it in, like from 2D to 3D to 4D to, I don't know, next to be 5D or something. So this is very impressive. And I hope all the people who are now inspired by Prasanna, they also get the guidance and they also start bringing lawyers to India. And I'm very, very happy that this innovative EUREYEKA series has been started by Yossi and Samir, excellent spearheading this EUREYEKA series. Very, very wonderful program to listen to and watch. Thank you.
Thank you, sir. Thank you, John, sir. We all, again, as I told, sir, the Pondicherry days, and of course, Nilesh is here, reminiscent. I somehow always feel blessed to, sandwiched between you both. Coimbatore was Nilesh and Pondi was you, and we all were able to start something out of the box. Be it digs that Nilesh started in Coimbatore, and you with all your innovations, which started with a 700 rupee adapter. And now I think people like Samir and there is a younger lot who are coming up with a lot of ideas. And I still remember how you guys all made sure it went the long way. I remember one of the posts by Nilesh in the cover image of Journal of Glaucoma or Ophthalmology Glaucoma, if I'm getting it right. And getting it exactly out into the market is something I learned from you guys also. I think Nilesh has 2, 3 product commercialized into the market, and Dr. John also has his own products that he is working on and which he has got out. I think, as you rightly told, sir, those aspects of trying and trying again, So this was my fourth attempt in Accelerator or the winning pitch. So it's always the tip of the iceberg that sometimes gets seen. So every time when you go, I did not know what was a business model when I applied for the first time. And when he asked me about business model, I told, I'll give you this much, you give me this much. That's all, like a simple currency. Then we had to sit with the accountant, we had to sit with the marketing strategist. What is the model that we need to pitch? So another point is, though 5,000 USD is the winning amount, you get connected with so many industry partners, and you will be able to go a different level where some industry will totally come and invest into you. So I'm getting another two, three peoples where who are still interested, and the award is just one part of it, as Kim sir beautifully summarized. That is just to motivate us and make sure we belong here. But then the investors coming to us is the next step. So yeah, so try again and don't think it's not a good innovation. It may not work out, because if I had given up in my fourth attempt, then I would haven't got this. So yeah, that's another thing that I wanted to share to the UC members out here who are listening to it.
Thank you so much, John sir and Prasanna sir. And over to the person without whose support this entire series wouldn't have been possible, our UC Secretary Nilesh sir. Sir, your words.
Thank you, Samir. First of all, that you are still like you are doing it continuously. This innovation cell, when I joined UC in like 4 years back, this is the first thing that Sonal ma'am, I think, was going to take over, and then Devakant sir also was secretary at that time. So they both wanted me to take it forward, but somehow I couldn't get it kicked off. Like I wanted to do this, like how to get innovation in everybody's mindset and to break that initial barrier. That is what we all are trying to do here, and I couldn't do. But kudos to you. You are continuously doing it. That's a great job that you have. And I again, what you are telling, like John sir is little senior to me, but me and Prasanna sir, like our innovation journey is quite similar. We are from the same batch of innovators. So, so
Last, the last of the lot.
the
We are
last of
on
the.
the verge of retirement.
Don't call me old, please. You should not have started so early. You started from kindergarten.
Sir, we are the last of the OGs.
But yeah, it's really great. I think this innovation scene has picked up so much, and from especially from Arvind Pondy, that spark has gone, and everybody saw that even residency. Like when I did, everybody was like in residency, how you can do, and that was one of the first thing when I was in the finale of that India's what the India's next ophthalmology that was from Partha Sir, scientific committee
Yeah,
talent search, all India talent search that was done.
correct.
And in that one of the international judges told that you did it in residency, and I can relate to you because he had developed the intraoperative OCT during his residency. He was the innovator of that. So but I think next year to that, we saw so many residents in the Think Under the Apple Tree that was coming from Arvind Pondy, I think, thanks to Venkatesh sir. That innovation mindset has gone into everyone, and now everybody is thinking out of the box quickly. Like any problem is there, there is a frugal solution that is there. Now the next thing is what Prasanna sir is going to is talking about. Like we should not stop on these frugal steps, that a jugaad kind of thing. India needs to now go more the China way, start commercializing it and make it our soft power rather than just going making it to be usable by one or two. So that's why we all are aiming for is to get it more commercial. Probably that ecosystem will come with help of what the LVPI incubation is there. AIOS is supporting that, and probably we also will try
We
to score
also.
some collaboration with the VC funding. We if we see more coming from UC, we probably should think about getting a VC collaboration for UC members, as what we you are trying to do at UCCon. So let's take this opportunity also to invite everyone to UCCon. Those who want to innovate, we are going to have biomedical engineers and software engineers and 3D printers and everything at UCCon. And there will be 3 days of hackathon, not one day or 4 hours. Yeah, from the first day to the last day, you will be in a room developing what you want, and at the end, there will be CEOs from well-known Indian companies who can take up your idea if they like it there and give you an offer right there to start commercializing. So let's take that. That is again being headed by Samir. All the best for that. That's awesome. That's
Thank you.
simply
Thank
awesome.
you. Thank
Thank
you,
you, sir.
Nilesh.
Wonderful.
I totally resonate with you, Nilesh. Actually, I think we were one of the sets which started in the Apple Tree and the talent search events that happened with the parent society. So what happens to the Vayos out there that I would want to tell is, in 2021, I founded my company. It's a proper MSME based company. I gave it a lot of thought. Is it worth it? Is it something that I would be able to manage? Because you want to have your clinical practice, your surgical practice, but will it be possible? Again, I was consulting with Dr. John at that time, and he also pushed me, if you can, go for it. So for all the innovators out there, a company means you can have a particular, a 10 by 10 feet area in your clinics itself, and try to go that way, because an idea will will be able to go only that much. That it took me 3 4 years to understand that, and I think Nilesh should agree with me, and he just resonated the same. Whereas now it is about the business model, what is the capital investments, who are going to be the investors. So when we travel, it gets a different perspective, and these competitions throws more light on marketing, business model, how you go about your things that you go about, and thinking out from investors' point of view. I was guided correctly at the early stage, and if anybody is watching this, and if you feel your idea can go the long way, definitely form your startup and get your trademark, website, all these things. You never know when it will help you in the long run. Even today, out of winning pitch, to deviate a bit, so we are working on many AI solutions. So whenever we work with another solution, as an individual to individual, it doesn't work that way. But when a company to a company, so we are having an MOU with Sandston. So these are some of my disclosures. So Sandston is an AI solution company based in Namakkal. Then last year I was lucky to work with a project with Dr. EUREYEKA sir and University of California in LA. So whenever people come to you, they come with you an NDA, or they come with you the proposal. When you have a startup, you are able to go with an MOU, file your patent not in your name but in your startup's name, and you be the director of that startup. So all these things has a lot of role in expediting the patent IP, and if it's going to be a commercialized product, you can also project it through your startup and don't project it through you. Because sometimes when we go for a competition, we think we are the one who created that, and we will invariably, our mind tends to think we will file the patent on our name. So don't file the patent on your name, form a company and then do it in the company's name. So these are some of the things that was told to me when I presented in Apple Tree and other events. I was able to meet the right people, like my colleagues Nilesh here, John Davis, my senior, and forming a startup change the way you approach a business algorithm or a marketing algorithm, and that now keeps running. You can now go into your clinics, hire people, it will keep running. The money will come. Initially, maybe you will have to put money from your clinics into it, which I did like that, and I'm still doing to an extent. But now it is running on its own. So I am spending more lesser time in it, and I think each one of you also will be able to see it once you start doing it. It's a tough jump, but once you do it, 4 years or 5 years later, you will reap the rewards. Yeah.
Thank you so much, sir, for the very, very inspiring talk and sharing your valuable points. So, the thing is, like, a lot of us, have ideas for innovations, and it's simple. And many of us might have our, like, the first prototype ready, but we don't usually see through it. And they just, end up lying, what they call as orphan innovation. So, the amount, I have seen how hard Prasanna sir works. Recently also I got a chance to share a room with him. So I know how focused and how hardworking he is. And I also remember Dr. Suvain Bhattacharji's talk in our first episode of the webinar series, where he showed his journey of the development of BX ring. So he was telling that he had a one dedicated room which he used to enter on a Friday and used to come out only come out of it only on Monday morning. So that is the amount of hard work which usually requires the perseverance, the persistence, which is usually required for making any innovation
I'll
successful.
I'll like to interject Samir just once at this point of time. When you are talking about Suren sir, during that innovation webinar when he was there, he was actually working on B-Octa. So he was working and I was doing the prototype research at my hospital. The trials were going on, and that is one thing that he and both Ashish Sharma sir has told me. It's important to talk about your innovation once you are correct about it, but during that journey also he was tempted to tell about B Octa that he is still improving, but it is also important to keep quiet till a certain point of time, till you are absolutely bang on it and you have that intellectual right on that. So sometimes especially in residency we tend to become very excited when we discover something and we start talking about it, but there is a little bit of secrecy that also is required, that also comes with training.
Rightly pointed, actually.
Yeah.
One of the apple tree competitions, I remember Rohit Shetty sir telling, if you guys haven't filed a patent, you can stop presenting it and you can come back again before it goes into the market. Yeah, that is one thing. And even I think Nilesh here, I mean, you have come out with the commercialized products for Diggs and Diggs Pro, and I think he also has closely worked on how to commercialize. So I would like to actually acknowledge Yossi. When I was on the other side, when you told, I remembered the keynote lecture in Mumbai when we had Suvin sir's talk on. We had the Mumbai was one of the first congresses after COVID physical conference. So Yossi had I think we had a 20-25 minute lecture on patency, and sir gave a complete list of how to go about things. I think these are all the grinding steps that we need to do. And I think Nilesh was one of the organizing members at that time in Mumbai, and Karan was also there. And I was trying to handle the session like how Samir was here at that time. We need to just be consistent with the way and with the people that we travel, just catch on to that points and come forward with it. So I was recently seeing Dr. John also circulating the next accelerator competition. So just fill in the forms, see the rejections, even if it's 4 times, 5 times, you will learn the business model and the marketing strategy, and you can come back stronger and you will get your day. Yeah.
Thank you so much, sir. So, as we all know that, innovations, even now, like whatever conferences or events that are happening related to ophthalmology, innovations are coming a big way. And it can be in any form, whether it is a surgery, whether it is an instrument, or even in the form of a software. So, innovations are the future. And to keep that momentum, we'll come again with another episode very soon. And with that, I would like to thank our speaker, Dr. Prasanna Venkatesh Ramesh, who shared his very inspiring talk. Our eminent panelists, Dr. Kim Ramasamy sir and Dr. John Davis Akara sir, and obviously my co-moderator and our secretary, Dr. Nilesh Kumar sir, and obviously Dr. Devakant sir, our president, UC. Without the support of the two, Nilesh sir and Devakant sir, this series wouldn't have been possible. So a big thank you to you both, and obviously Numerotech for the technical support. So thank you everyone for joining us today. We'll see you again very soon. Thank you.
Thank you, Sam.
Ma'am, we
Thank you,
can
Samir.
go offline.
Yeah. Good night.
Okay, doctor, 1 second.